As clinicians, we've all been there, right? That sinking feeling when a session just stalls. The path forward with a client gets murky, and you start to feel frustrated. Well, today we're going to talk about how to turn those stuck points into something really powerful, not just for our clients, but for our own growth as therapists. Let's dive in.
I love this quote because it just nails it. The goal is not a problem-free practice. That's impossible. The real goal is to get really good at the process, to become experts at spotting problems, figuring out where they came from, and knowing exactly how to fix them. These challenges are not just inevitable, they're actually invaluable.
So, here's our game plan. We'll start with the mindset. Then we'll get practical on how to even spot a problem in the first place. After that, we'll talk about how to think about them, what to do about them, and we'll wrap up by, looking in the mirror.
Okay, this right here, this is the most important shift you can make. The very second you feel stuck, I want you to reframe it. It's not a failure. It's a sudden flood of rich clinical data. Think of it like a spotlight that's suddenly shining on something important, something deeper about your client, and it's also your chance to level up your own skills. So if these stuck points are valuable data, well, how do we actually collect it? You can't solve a problem you don't know you have. So let's talk about picking up those first, sometimes really subtle clues that things are veering off course.
There are really 4 main channels to tune into. Sometimes it's direct, a client just comes out and says something, or maybe we ask for it. But honestly, the real gold is usually in the other 2. Taking the time to review recordings of our own sessions, which I know can be humbling, and using objective tests to track progress. And let's be real, we know this from being in the chair. The most important feedback is almost never a direct complaint. It's hidden in the little things. The second a client says, "I see what you're saying, but," or you get that super hesitant, "Yeah, I'll try." Bam, that's your cue. That's your moment to pause and say, "Hey, what's coming up for you right now?"
This is a perfect example. Some of the loudest information you'll get in a session is completely silent. It's that faraway look in their eyes, the restless shifting in their seat. Those cues are screaming at you. Maybe they're lost. Maybe they totally disagree. Either way, that's your signal to stop and check in.
So how do you check in effectively? Here are a few great techniques. The one I really love is asking the patient to rate their belief in a new thought from 0 to 100. It tells you so much more than a simple yes. And the other one, for me, this is non-negotiable. Save the last 2 minutes of every single session to ask for feedback. It catches so many problems before they have a chance to grow.
All right, so spotting a problem is one thing, but what you do with that information, that's where the real skill comes in. And honestly, this is where I see a lot of us, especially earlier in our careers, fall into a really unhelpful trap.
Oh, it's so tempting, isn't it, to just slap on a label. He's just resistant. She's unmotivated. It feels neat and tidy, but those labels are clinical dead ends. They shut down curiosity. The crucial move, is to go from judging to describing. Instead of "he's resistant," you ask, "Okay, what did he actually say or not say?" That one little shift pulls you out of frustration and puts you right back into problem-solving mode.
And before you even dive into the client's thinking, you got to look at the alliance. You have to ask yourself these questions and be brutally honest. Are we really a team here? Is the work being shared? If you hesitate for even a second, that's where you start. The problem isn't out there with the client. It's right here, in the room, with the 2 of you.
And look, this next one takes some real humility. We have to be willing to ask, how does my client actually see me? Do they believe I'm competent? Do they feel like I care? Because at the end of the day, their perception is the reality of the therapeutic relationship. It's a huge piece of the puzzle.
Okay, so you've spotted the problem. You've conceptualized it with curiosity instead of blame. So now what do you actually do? Let's open up the toolkit and look at some concrete strategies to get things moving again.
Think of this as your 5-point inspection. When things feel stuck, just run down this list. Is the alliance shaky? Are the goals fuzzy? Does the client actually buy into the model we're using? Or, hey, is there something external, a medical issue, a major life stressor that we're missing? 9 times out of 10, this quick scan will point you right to the issue.
So, once you've diagnosed it, here are some things you can do. And notice the common thread here, right? It's all about collaboration. Bringing the client in on the problem solving, refining the conceptualization with them, reviewing the model together. And sometimes the fix isn't some fancy new technique. It's as simple as just slowing down the session.
Okay, we've looked at the client, we've looked at the alliance, we've looked at the process. For our last section, we need to turn that lens right back on ourselves. This is arguably the most important and definitely the most overlooked piece of this whole puzzle.
We have to remember, we are not immune. We have the same cognitive distortions that we help our clients with every single day. Our own automatic thoughts about our clients, about ourselves, about therapy can be the single biggest thing getting in the way.
Come on, who here has had this exact thought? It's a classic. And you know where it leads? To those rambling, unstructured sessions where you get to the end and feel like you accomplished nothing. All because we were afraid of what a gentle interruption might mean. We have to be willing to challenge our own thoughts, just like we ask our clients to.
And here are a few more greatest hits. The fear that an agenda kills rapport. The fear of listening to yourself on a recording. The fear that if a client gets upset, they'll leave forever. The first step is just to notice these thoughts. And the second step is to do our own work on them. Treat them like hypotheses to be tested, not facts.
So it all boils down to this. When you hit that wall, when you feel stuck, you are at a choice point. You can go down the road of blame and frustration, or you can see it for what it is, a golden opportunity to learn, to grow, and to become a better therapist.
So that's the question I want to leave you with for your next clinical week. The next time you feel that friction, that stuckness, just pause for a second and ask yourself, what am I choosing to see here? Is this a roadblock or is this an opportunity? Because making that shift right there in that moment, that's not just how you get unstuck, that is how you master this craft.